Hello, good afternoon. Welcome again to my YouTube channel, and I'm still your favorite Nurse Precious Amaka, or you can call me Nurse P. So today we are going to do a continuation of what we did in the last video. In the last video, I talked about STIs, and I said in our next video we'll be treating gonorrhea as a bacterial infection. So now let's get into the video. Well, so gonorrhea is a bacterial infection which if left untreated has fatal complications like damage to the reproductive system and infertility. Now, in men, gonorrhea is symptomatic. What I mean is that the symptom is more pronounced in men than in women. In men, once you want to know any guy that has it, the number one thing they complain about is pain during urination. There's this severe pain they feel. You see a grown-up man crying in the hospital because of this. It's very, very bad. And they also have discharge in men too, and itching. Now, in women, it's a bit difficult to detect it because it is asymptomatic in the sense that they don't feel symptoms like in men, but they usually experience vaginal discharges. They are greenish in color, or should I go greenish? Yeah, greenish in color and yellowish in color with itching. And like I said, some women can have it for years and they won't know. Now, this is where medical tests comes in. How do you know you have this infection? You have to go for a routine check, a urinalysis, or a high vaginal swab, or an ultrasound scan. Why I said ultrasound scan is because most times when there is an infection, there's usually fluid in the pouch of Douglas. Don't get confused, please. Now, once a fluid is detected during an ultrasound scan, even if it's little, pelvic inflammatory disease is queried. And that is where you have to go for an HVS so that you know the organism and the infection that is there. Well, complications of this infection. We have damage to the testicles in men. That is why I said in men it's very dangerous. There's damage to the testicles, to the reproductive system. Now, this infection can cause low sperm count, and it can also cause infections to other parts of your body, like the joints. Yes, people who suffer from gonorrhea in its complicated form or stage usually complain a lot about joint pain. Then in women, infertility. Also in men. Now, what is the treatment for gonorrhea? It is not difficult to treat. because a lot of people have this misconception. I've treated this infection, they go, it's not getting healed, I'm not feeling better. It's a lie. You are not feeling better because you are not taking precautions. You're not doing the right thing. You're not doing the ideal thing that you are supposed to do. Now, if you want to treat it, you have to use an antibiotics. Yeah, an antibiotics is needed. That is after you have gone for a routine check. You have done urinalysis, you have done high vaginal swab, you have done an ultrasound scan, and everything is pointing to this diagnosis, gonorrhea. You need an antibiotics. And if you are very buoyant, I usually advise people any infection that has to do with the reproductive system, please go for branded injections. It's preferable to go for injections. I prefer injections, they act faster. So if you need a prescription, you have to send an email to me, and that will require a little consultation fee. It's not much. The reason I'm saying consultation fee, a lot of people abuse drugs. If I just keep the prescription open, everybody will just go and start buying injections. I heard somebody say, no, that is why I said it would require a little consultation fee. And you must tell me you have done a urinalysis, an HVS, and an ultrasound scan. I can rule out the ultrasound scan because once the HVS and the urinalysis says it is there, there's no need for the ultrasound scan. So in women, the treatment is the same thing. Now, how do you prevent gonorrhea? How do you prevent yourself from having it? It's not difficult. Sometimes it's infidelity, lack of, should I say, inability to be faithful to one partner. A lot of people are not faithful. Today they are with Agnes, tomorrow they are with Matthew, next tomorrow they are with James and John. You make yourself prone to infections. Now, there's something I left out. Gonorrhea makes you prone to contracting HIV. Yes. If you don't understand, leave a comment in the comment section. It makes you prone to contracting HIV because there's a scarring on the reproductive system. And once there's a scarring, you are open to infections. Well, when I'm treating HIV infections, I'll tell you how gonorrhea comes in and how infections comes in. Well, in the management of this, should I say prevention, you have to be faithful, you have to maintain proper hygiene and use protective measures. Use protection. We have condoms. They are very cheap. But a lot of people, I don't know, just joke with their health, and it is not a good one. Let's learn to use protective measures, especially for singles that cannot be celibate or stay away from having sexual intercourse. You have to learn how to use condoms. We have female condoms, we have male condoms, but the truth is male condoms is more in use than female condoms. Well, I'm going to end this video here. Please do well to subscribe to my channel and give this video a thumbs up. I'm still your favorite nurse P. See you in my next video. Bye.